Hello everyone, welcome back to my channel. In this video I am going to discuss about the anatomy of carotid triangle and the muscular triangle. Carotid triangle is a part of the anterior triangle. In this diagram we have highlighted the location of the carotid triangle. Now the boundaries of the carotid triangle. Anterosuperiorly it is bounded by the posterior valley of digastric, anteroinferiorly by the superior valley of omohyoid, and posteriorly by the anterior border of sternocleidomastoid muscle. The roof is made up of the skin, superficial fascia, investing layer of the deep cervical fascia. Then the floor is contributed by the muscles of pharynx. These are the middle constrictor and the inferior constrictor of the pharynx, hyoglossus and thyrohyoid muscle. Now the contents of carotid triangle. The important contents are common carotid artery, internal jugular vein, and the vagus nerve. These structures are enclosed in a sheath which is known as carotid sheath. Carotid sheath is a fibrous connective tissue that encircles the vascular compartment of the neck. It is deriving from all the three layers of the deep cervical fascia of the neck, that is investing layer, pretracheal and prevertebral layer. Anterior layer of the carotid sheath extends from base of the skull to the C3-C4 vertebral level, and the posterior layer extends from base of the skull to the adventitia of the aortic arch. This sheath is thinnest over the vein and thicker over the arteries. This carotid sheath has three compartments, that is intermediate, medial and lateral compartment. Medially it is giving passage for arteries, that is your common carotid artery and internal carotid artery in the upper part. Laterally it gives a passage for internal jugular vein along its whole length, and in between these two in a posterior plane we have the vagus nerve. Now the relations. Anteriorly it is related to the ansa cervicalis. Upper part of the sheath it is crossed by 9th, 10th and 11th cranial nerves. Posteriorly it is related to the sympathetic chain and deep cervical group of lymph nodes. Now first we discuss about the common carotid artery. It can be described under these points. First is the origin. It arises from, on the left side it is a direct branch of the aortic arch, and on the right side it arises from the brachiocephalic artery. Then after taking origin it runs upwards in the neck and it divides at the level of superior border of thyroid cartilage into internal and external carotid arteries. This level is the intervertebral disc between C3 and C4 vertebra. This external carotid artery enters into the parotid gland, and behind the neck of mandible it divides into its two terminal branches, that is superficial temporal and maxillary artery. While the internal carotid artery does not provide any branch in the neck, and it directly enters into the carotid canal at the base of your skull and supplies the brain area. Now the structures between external and internal carotid arteries. These are part of the parotid gland, styloid process, styloglossus, stylopharyngeus muscle, glossopharyngeal nerve, and pharyngeal branch of the vagus nerve. Now the branches of the external carotid artery. The two terminal branches are superficial temporal and the maxillary artery, while it also supplies to the scalp, face, maxilla, tongue and the thyroid gland. The branches of the external carotid artery are 8 in number, and they can be remembered by this mnemonic, that is 7 angry ladies fighting over PMS. 7 means superior thyroid artery, ascending pharyngeal artery, ladies means lingual artery, fighting stands for facial, over is for the occipital artery, posterior auricular artery comes from the P, M stands for maxillary artery, and S stands for superficial temporal artery. Now we discuss individual arteries. First is ascending pharyngeal artery. This is the first and the smallest branch, arising from the medial aspect of the external carotid artery, and it extends to the base of the skull between the pharynx and internal carotid artery. It provides branches to the pharynx, tonsil, soft palate and medial wall of the tympanic cavity and the dura mater. In the diagram we can see the ascending pharyngeal artery this is the ascending pharyngeal artery which is supplying to these structures. Next we have superior thyroid artery. It arises from the front of the external carotid artery and it arises below the tip of the greater cornu of the hyoid bone. It runs downwards and forwards accompanied by the external laryngeal nerve and reaches to the upper pole of the lateral lobes of the thyroid gland. This supplies to the upper part of the thyroid gland. Next is your lingual artery. It again arises from the front of the external carotid artery just opposite to the tip of the greater cornu of the hyoid bone, and it is divided into three parts with the help of hyoglossus muscle. The first part lies in the carotid triangle and extends from the origin up to the posterior border of the hyoglossus muscle. So here we can see the hyoglossus muscle. This is its posterior border and this is the anterior border of the hyoglossus muscle. The second part of the lingual artery lies deep to the hyoglossus muscle, and the third part extends from the anterior border of the hyoglossus muscle. So this is the lingual artery. The basic area of supply is the tongue. Next we have the facial artery. Facial artery arises from the front of the external carotid artery just above the tip of the greater cornu of the hyoid bone, and it terminates at the medial angle of the eye as the angular artery. The course of the facial artery has been divided into two parts, that is the cervical and the facial part. Cervical part is that part which is lying in the neck, and the branches from the cervical part, these are ascending palatine, tonsillar branch, glandular branch and submental artery. In the facial part, the branches are inferior labial artery, this is superior labial artery, this is lateral nasal artery, and the further continuation is the angular artery of the facial artery. This facial artery possesses a sinus course in its path, that is, first it takes a inverted U-shaped course around the submandibular gland, and the second second course is around the lower border of the mandible. Here it again turns and runs upwards into the face. At the anterior-inferior angle of the masseter, it pierces the deep fascia of the neck and continues upwards and forwards into the face to supply the facial area. Next branch is the occipital artery. It arises from the posterior aspect of the external carotid artery opposite the origin of facial artery. It also runs upwards and backwards under the cover of posterior belly of digastric muscle and appears tortuously in the posterior part of the scalp. In the diagram we have highlighted the occipital artery with the green color. So here we can see it is supplying to the posterior part of the scalp up to the vertex. Next is the posterior auricular artery. It arises from the posterior aspect of the external carotid artery above the origin of occipital artery and passes upwards and backwards along the upper border of posterior belly of digastric muscle. Here we can see the origin of posterior auricular artery above the occipital artery. This posterior auricular artery supplies to the lateral surface of the cranial and the cranial as well as lateral surface of the auricle, scalp, and the auricle and the tympanic membrane. Next branch is the superficial temporal artery. This is another smaller terminal branch which arises within the parotid gland behind the neck of mandible. It is accompanied by the auriculotemporal nerve. Here we can see the superficial temporal artery. Now the branches of superficial temporal arteries are highlighted with this blue colored arrow mark. These are transverse facial artery, zygomatico-orbital artery, frontal branch, parietal branch, anterior auricular branch, middle temporal branch of the superficial temporal artery. Basically it is supplying to the scalp of the temporal area as well as the face. The last branch, that is your maxillary artery. It is a larger terminal branch of the external carotid artery. It arises within the parotid gland behind the neck of mandible, and it supplies to the upper and the lower jaws, muscles of mastication, palate, and the nose. Then we have the carotid sinus. Carotid sinus is a dilatation at the proximal part of the internal carotid artery. The wall of this sinus is thinner and more elastic than the adjacent part of the artery. It is supplied by the glossopharyngeal nerve, vagus nerve, and the sympathetic trunk. It acts as a baroreceptor for controlling the intracranial blood pressure. Stimulation of this produces reflex fall of blood pressure and slowing of the heart rate. The applied related to this is carotid sinus syndrome. Carotid sinus is richly supplied by the nerves. In some persons, it may be hypersensitive. In such person, on sudden rotation of the head, it may cause slowing of the heart. This is known as carotid sinus syndrome. So neck should be tied very loosely around the neck because it may compress both the internal carotid arteries supplying the brain. This may result into fainting. Next is carotid body. It is a small reddish brown ovoid mass of tissue that lies on the medial side of the bifurcation of the common carotid artery in close relation with the carotid sinus. In the diagram we can see the carotid body. It is supplied by the glossopharyngeal nerve, vagus nerve, and the sympathetic nerves. It is also a chemoreceptor that monitors the level of oxygen in the blood. It is stimulated by low level of oxygen and initiates a reflex that increases the rate and depth of respiration, cardiac rate, and blood pressure. Applied related to this is potato tumor. It is the enlargement of carotid body. This tumor moves transversely, shows transmitted pulsations, and it is associated with slow pulse, attacks of fainting due to pressure on carotid sinus. The next content is the internal jugular vein. Internal jugular vein, the beginning is in the form of sigmoid sinus at the jugular foramen. At the beginning, this vein possesses a bulb, a dilatation known as superior bulb. It extends from base of the skull to the root of the neck. It is overlapped by sternocleidomastoid and surrounded by the carotid sheath. It terminates at the subclavian vein. At the termination, it again bears inferior bulb which is guarded by a pair of valves. The tributaries of the internal jugular vein are corresponding to the branches of facial external carotid artery. Now applied. It acts as a guide for surgeons during removal of cervical lymph nodes. As the deep cervical group of lymph nodes, they are located close relation with the internal jugular vein, so it is acting as a guide. The safer way to cannulate the vein is to introduce the needle through supraclavicular triangle in upward and backward direction. If a thrill is felt at the root of the neck, overlying the vein during atrial systolic contraction, it may shows the stenosis of the mitral valve. Next, Quicken-Stitt's test. It is the rate of flow of CSF is increased during lumbar puncture when both the internal jugular veins are compressed. If this is not so, that is, if there is absence of pressure rise in the compression of the veins, it will indicate a complete or partial block of the subarachnoid space. Then we have another content. These are the spinal part of accessory nerve. Spinal part of accessory nerve, it passes through the upper angle of the triangle, either superficial or deep to the internal jugular vein. In the diagram we can see this is the spinal accessory nerve. Next is the loop of hypoglossal nerve. It crosses the superficial to the internal and external carotid arteries. It provides two branches from the convex side, that is the descendens hypoglossae. So this is the descending branch, this is descendens hypoglossae, which is supplying to the superior valley of femohyoid, and it is also carrying some fibers from C1 spinal nerve. Other branch is to nerve of thyrohyoid. This is the nerve to thyrohyoid muscle. This is the another branch from the loop of hypoglossal nerve. Then we have the another content, that is your vagus nerve or 10th cranial nerve. Vagus nerve is a critical nerve for supplying the parasympathetic information to the visceral organs of respiratory, digestive, and urinary systems. It is important in the control of heart rate, bronchoconstriction, and digestive processes. The vagus nerve passes downwards within the carotid sheath between the internal jugular vein and carotid artery. The branches are the pharyngeal branch, as we can see in the diagram, superior laryngeal nerve. This superior laryngeal nerve further divides into external or internal laryngeal nerve. And this is the recurrent laryngeal nerve. This is the sinus branch of the vagus nerve, which is supplying to the carotid sinus. Also, superior and inferior cervical cardiac branches arises, which is supplying to the heart. Another content is cervical part of sympathetic trunk. Although it is not a content, but it can be visualized after lateral retraction of the carotid sheath. In the diagram we can see, along with the trunk we have superior, middle and inferior cervical ganglions of the sympathetic chain, which are lying in front of the prevertebral fascia and the underlying muscles. So here we can see the vagus nerve. This is the vagus nerve, this one yellow colored, and this is the cervical sympathetic chain. The next content is the ansa cervicalis. Ansa means loop. It is a loop which is made up of cervical spinal nerves, and it is lying in front of the carotid sheath. It is formed by the union of descending nerves. That is, first descending nerve is the descendens hypoglossae, which is forming the superior root, and the second is inferior root. These are supplying to the three infrahyoid muscles, that is omohyoid, sternohyoid and sternothyroid. This is the ansa cervicalis. Here we can see the two roots of the ansa cervicalis. This is the upper root and this is the lower root. The upper root is made up of the descendens branch of the hypoglossal nerve and the C1 spinal nerve, and the lower root is made up of C2 and C3 spinal nerves. This ansa cervicalis is supplying to the superior belly of omohyoid, sternothyroid, sternohyoid, inferior belly of omohyoid and thyroid muscles. The other structures are the part of parotid gland and the deep cervical group of lymph nodes. First is jugulo-digastric node. This is a deep cervical lymph node. This is jugulo-digastric and this is jugulo-omohyoid lymph node, located in close relation with the internal jugular vein. Next triangle is your muscular triangle. This has been highlighted with the red color area in the anterior aspect of the neck. The boundaries are, it is located, the anterior boundary is made up of the anterior median line of the neck from the hyoid bone to the sternum. Above and behind it is bounded by the superior belly of omohyoid. Below and behind it is bounded by the sternocleidomastoid. So this is the above and behind, and this is below and behind, and this is the anterior median line, which is forming the anterior boundary of the muscular triangle. Now the contents of the muscular triangle, it is made up of infrahyoid muscles and the viscera like thyroid and parathyroid glands, trachea, esophagus and larynx. These are the another contents of the muscular triangle. Thyroid gland is an endocrine gland. It is lying deep to the sternothyroid, sternohyoid muscles. It is butterfly in shape. So here we can see the location of the thyroid gland. Thyroid gland is containing a isthmus and two lobes, that is right and the left lobes. These are the infrahyoid muscles. This is your sternohyoid. This sternohyoid takes origin from the posterior surface of manubrium sterni and inserted on the lower border of the body of hyoid bone. In the diagram we can see the body of the hyoid bone. Next muscle is your sternothyroid. This is the sternothyroid. It arises from the posterior surface of the manubrium sterni and inserted on the oblique line of thyroid cartilage. This is the thyroid cartilage. Next muscle is your thyrohyoid muscle. Thyrohyoid muscle arises from the oblique line of thyroid cartilage and inserts on the lower border of the body as well as the greater cornu of the hyoid bone. Another muscle is the omohyoid. Omohyoid muscle contains two bellies. This is the superior belly, arising from the lower border of the body of hyoid bone, inserts with the help of this loop on the clavicle. Then the inferior belly arises from the superior border of the scapula and inserts on this intermediate tendon, which is connecting this belly with the clavicle. These infrahyoid muscles, they are supplied by the ansa cervicalis, and their function is the downward movement of the hyoid bone and the larynx. So these are the attachments, action, nerve supply of these infrahyoid muscles. Now the clinical anatomy. If there is common anterior midline swelling in the neck, it may be because of enlargement of some mental group of lymph nodes, goiter, carcinoma of the larynx, and large lymph nodes in the suprasternal region. Another is the Ludwig's angina. This Ludwig's angina is a type of bacterial infection that occurs in the floor of the mouth, under the tongue. It often develops after an infection of the root of the teeth, that is root abscess or mouth injury. It presents enlargement of the submandibular space, that is also tenderness of the neck above the level of hyoid bone, pain in the neck and the floor of the mouth, and restricted neck movements. So this is all about the carotid and the muscular triangles of neck. Thanks for watching.